Good morning. My name is Katherine Kaufka Walts. I'm the director of the Center for the Human Rights of Children. We have a lot of ground to cover here today. We are here to learn more about our public systems and how they, as well as research and promising practices to ensure that all children and families have access to a safe and healthy environment. Speaking of, we are very grateful to our speakers to be here with us today to educate us about their work, their challenges, and opportunities in working to provide our children a safe and healthy place to live and grow. I would like to begin briefly by providing some context to why we thought it was important to convene today's briefing, and also to highlight briefly some of the work that Loyola has been working on related to lead, healthy homes, and the environment. The mission of our center, the Center for the Human Rights of Children, is to advance and to protect the rights of children. More recently, we've been exploring the intersection of children's rights and health, particularly related to environmental toxins and a right to healthy environment. Environmental pollutants, including lead, affect millions of children each year, and we know that children, because of their developing brains and developing bodies, are at greater risk of lead and other toxins and suffer disproportionately. The recent Flint lead crisis, as well as the crises around municipalities across the country, has shown us that access to clean water is not just a health issue, but a social justice issue, and also a human rights issue. We see that marginalized groups, especially children, are often at greater risk of lead and environmental contamination. Flint has also demonstrated the complexities about the role of both public and private agencies in ensuring that the spaces we live, work, and go to school don't pose a danger to our health. This is both a local and a global issue. Last year, the United Nations identified environmental protection as one of the key indicators of a nation-state's ability to ensure the future well-being of children around the world. With 196 state parties, with a single exception of the United States, the UN Convention on the Rights of the Child is the single most widely ratified and monitored human rights treaty. It sets out the civil, political, social, and cultural rights of children. Under the Convention on the Rights of the Child, children have the right to the highest attainable standard of health, and state parties have a duty to, quote, combat disease and malnutrition through the provision of adequate nutritious foods, clean drinking water, taking into consideration the dangers and risks of environmental pollution, end quote. Yet a children's rights approach is often overlooked in developing environmental-related policies and standards. This is a very complex issue requiring the expertise of scientists, public health, and medical professionals, educators, research, policymakers, community members, and activists, among others. Loyola has been engaged in several initiatives to promote social justice through such a multidisciplinary lens, and I'd like to just take a minute to highlight a few. In 2012, Loyola established the Advancing Healthy Homes and Healthy Communities initiative. As part of this initiative, we developed a multidiscipline and multi-sector model to address a broad range of environmental toxins, including lead, but also mold, radon, carbon monoxide, and moisture. The efforts of the Advancing Healthy Homes initiative included research, community mapping, and a working summit in 2014 right here in this room to begin developing an action plan and agenda for moving forward. And I'm pleased to see that many of you who were involved in planning the summit and those who attended the summit are here today, both as speakers and also as participants. As part of the Advancing Healthy Homes initiative, we also work with university partners, including Loyola Center for the Urban Research and Learning, the Institute of Environmental Sustainability, Loyola's Institute of Public Health program. And each of these institutes and centers and programs strive to use an interdisciplinary lens to address pressing social justice issues, including environmental toxins and their impact on health. A partner of the Loyola Healthy Homes program and co-organizer of today's briefing is the Civitas Child Law Center. But before I introduce my colleague, Anita Weinberg, who will provide a roadmap of today's program, I wanted to just briefly thank our staff at the Center for the Human Rights of Children, at the Civitas Child Law Center, the staff, students, faculty, and co-sponsors, and also a couple housekeeping items very briefly. For those of you that are unfamiliar with this floor, if you need to access restrooms, they are located right by the elevator banks from which you entered. If you're looking for parking validation, it will be provided to you downstairs in the lobby at the informational desk as you entered.